politics and the health sector. The National Assembly Health Committee says it will investigate claims that the Nairobi Women's Hospital has been exploiting patients. The committee chairperson, Sabina Chege, says her team will look into the matter once Parliament resumes a session next week and is asking all aggrieved persons to write to her committee. NTV's Silas Apollo walks us through the journey of what was founded as a safe haven to what is now perceived as less of a place of solace.
One morning in the early 2000s, a young medical doctor approached his boss with a business proposal. The young gynecologist had been thinking of a hospital where victims of gender-based violence could find hope and restoration through treatment and counseling. But his boss, not keen on the idea, advised the ambitious doctor to shelve it, or if he had to pursue the dream, start his own hospital. Not one to shy away from a good fight, Dr. Sam Thenya set on a mission to build a hospital that not only gave those victims a second chance, but also offered affordable quality health care.
I founded this organization to increase access to healthcare, and that's why our geographical footprint, that's why we have 9 hospitals, opening the 10th one in Eldoret. The second one was to lower the cost.
The facility even attracted lucrative deals from investors such as Dolores Jordan, NBA star Michael Jordan's mother. In 2003, she says she was invited to visit the Nairobi Women's Hospital with about 40 beds. The line outside was long, but they were all treated whether they had money or not. A very moving situation which led her to reach out to Dr. Thenya and started working with him to try to get some equipment for the hospital, including some of the things hospitals in the United States threw away. The facility, at least in the public's eye, has been growing in line with its intended vision at first. But over 19 years since the facility first opened its doors in the upmarket neighborhood of Hurlingham, its existence has been dogged by controversy. Its current image stands juxtaposed to the reputation the facility sought to build. The hospital has been accused of inflating patients' bills, something that insiders say has been a long-standing practice. Leaked internal messages show that patients were exploited through schemes such as unnecessary tests and admissions, as well as delayed discharges.
Let me say these allegations are not true. And at the same time say, this is not the Nairobi Women's Hospital board policy.
To the many who had pegged their hopes on the institution built on the foundation of providing a safe haven for the poor, the allegations could not have come at the right time.
Hii hospitali wamenifrustrate sana. Maana kila mara huwa wananipigia simu wakiniambia hii pesa unalipa kwa mwezi ni kidogo sana.
National Assembly Health Committee Chair Sabina Chege says the House team will investigate the matter.
We'll be calling the medical board so that they tell us whether there is anything that they know about Nairobi women. Our private hospitals, our insurances, please do not commercialize health in Kenya. And I keep on reminding them that this is blood money.
Dr. Thenya began by fighting for his dream. Now he's fighting the effects of patients' nightmares at a hospital that many say has turned from a haven into a hell-like experience. Silas Apollo, NTV.